Welcome to this edition of Research Connection. Joining me today is Michael Kato and Dr. Sarah Musulin. Thanks for joining me.
Thank you.
So tell us about yourself.
Okay, so I am Sarah Musulin. I'm a clinical associate professor here at State in the Emergency and Critical Care Department. I just give you a little background. So I went to veterinary school at Auburn. Then I did an internship at the University of Florida. I then did a couple years of emergency private practice and decided I wanted to do a residency. Came to NC State for my residency, loved it, and so I've been here ever since.
Nice.
And I'm Michael Kato. I am originally from Los Angeles, California. I did my veterinary school at UC Davis. Following that, I did a rotating internship at VCA in West Los Angeles, California. And now I'm here for a 3-year emergency critical care residency program at North Carolina State.
Great. And tell us about your research.
Great. So I have an interest, both my teaching and research interest is in transfusion medicine and blood banking. So primarily small animal transfusion medicine and blood banking. And so I've done some research projects. The most recent one, prior to the one we're going to tell you about today, was looking at a canine lyophilized albumin product. I worked with one of my residents, Dr. Brittany Enders, and we were looking at the safety and efficacy of a canine lyophilized albumin product. Just to give you a little bit of a background to introduce our project on just veterinary blood banking. Classically right now we store blood products such as canine and feline red blood cell products, concentrated products, and then plasma products. And then where we have a bit of a deficiency in veterinary blood banking is with platelet products. Platelet products kind of get finicky about being stored, or so we thought. And there's been an evolution over time as to how we use and store platelet products. And so that's where our project comes in. And we did receive a grant from the Veterinary Emergency and Critical Care Society for this project.
So our project is based off of the need for more platelet products in veterinary medicine. Currently, most of the platelet products that we have only have a shelf life of anywhere from 3 to 5 days. So for our intents and purposes, we don't have wide usage of them or wide availability of them. So the project that we're proposing is taking a type of blood product called whole blood, storing it in a refrigerated fashion, and looking at the efficacy of platelets and their function and their number to see if we're able to use them as platelet transfusions for the future, as a substitute for any sort of lyophilized platelets or freeze-dried platelets, in a sense, in veterinary medicine.
Can you tell us about the blood donor cats?
Sure. So we have a pretty robust blood bank here at NC State that I'm pretty proud of. So I help with the blood bank here at NC State, and we have anywhere usually between 50 and 60 community canine donors. So these are staff and community-owned dogs that they bring into the hospital for donations, and we provide preventative health care and wellness checks for them. And we're able to acquire those donations and store the blood. We also have kitty cats that we actually house in the hospital for a couple years, and then we find them homes. And the reason we have it set up like that is we feel like it's least stressful for the cats to be in-house, as opposed to, there's not many a cat that enjoys a car ride back and forth. And we've got a pretty cool setup for them. And then I will mention, because this is an opportunity to say that we love for those cats to have ample socialization and enrichment, and it's great for our emotional well-being as well. And so please ask where those kitty cats are, and we're happy for you to visit them and enjoy their companionship.
Thank you for sharing.
Sure, my pleasure, our pleasure.
Best of luck.
Thank you.
you.